I am British born, 75 years old. I went to live in Spain almost 20 years ago for a better life in a warmer climate. I live in a small place, the Mediterranean coast, where the climate is very nice. It's quite dry and dusty because we have the only desert in Europe, 15 miles inland from where I live. I was married to a doctor and stayed at home, and I have two sons who are now adults. My eldest son is an aquatic biologist with a doctorate. My youngest son, he lives in Sweden at the moment. He's a senior geologist with the largest mining company in Europe. And at the moment, he's in Indonesia diving. I used to write articles for magazines and travelogues I did because I have travelled extensively around the world. I enjoyed good health all through my life until I was about 60, 65, 66. Then things started to change. One of my friends had a really bad chest infection, and she came back and she was coughing and sneezing, and I picked this up about a month after she'd had it, and it didn't seem to go away. The cold went away, but I was left with a cough that came and went. And then I started to notice that I wasn't feeling so good. And after about 3 months of this cough not disappearing and the doctor giving me different things for it, you know, the normal antibiotics and cough medicines, I felt that something wasn't right. So I went to see a specialist in Almeria who he thought it was an allergic reaction to something. So he started with drops that were made up specially for me in a laboratory that I had to put under my tongue several times a day. And he gave me inhalers, and I had a chest x-ray and some other tests that he did, which he thought it was due to a dust allergy. So on the strength of that, I stripped my house of carpets and tried to make everything dust-free, which, you know, I mean, it's quite easy to really, but the part of Spain where I live is dusty because it's dry. It's a very arid climate. So the doctor said to me, the best thing you could do probably would be to move to a better climate where it was more moist. Well, I wasn't going to do that, so I just hoped that I would get better. So for about a year, well, I think it was about a year, I was treated by this specialist. And it sort of contained it, but it didn't go away. And after 3 years, I was getting worse. I went to see a doctor who was considered to be one of the top authorities in the world on lungs and chests in London. I spent a day with him. I had MRI scans done and blood tests done, and then I got a diagnosis, and he said it was mild bilateral bronchiectasis. I'd never even heard of that name before, didn't know it existed. And at the end of the day when we were talking about things, and he said to me, it can be managed. I want you to go back to Spain and take antibiotics for 4 weeks and let me know how you get on. So I took them for 4 weeks and it did clear up. And for 2 to 3 months, I felt great again. And I thought it's worked. But then it came back again. So I got in touch with him again and I said, I'm back to feeling not well again. He said, well, you have to take antibiotics again. That is the only alternative that you have now. When it's bad, antibiotics are the treatment. So that was the way I was going. And I carried on like that for probably a year, almost a year. And I still kept feeling that I wasn't firing on all cylinders, as if I was only on half power, because it does pull you down, especially when you can't breathe very well. I noticed that was getting worse. And I started looking on alternative therapies. And that's where I came across Dr. Ashok. So I tried this doctor. And I rang Dr. Ashok, told him I was going to be in Birmingham for one day as I was flying back to Spain the next day, and could I have an appointment to see him? And he said yes. When I met him, he was very professional. I've spent all my adult life with doctors and their families because I was part of a doctor's family. So I know what to expect, I know how they are, I know how they think, and I know how the professionalism comes over. Dr. Ashok was everything that he should have been. He was very kind, he listened. He'd already read my case history because I'd given that to him. And he examined me in a way that I'd never been examined before, because obviously I'd never met an Ayurvedic doctor before. So it wasn't a matter of, you need a chest x-ray, we'll sound your chest and we want blood tests. Whatever he did that day was totally different. But he said, I think I can make your life better, you know, with the quality of life, with the things I will prescribe for you. I was going back to Spain and he said he could send anything out to me in Spain and to start off with whatever he was going to give me and let him know how I got on. And he said in a few weeks you might feel like dropping off some of the things that the doctor has prescribed for you, but otherwise you can take the two together. Ayurvedic does not blank out any good that the other medicines are doing. And you might just think, can I stop this, can I drop this? If you feel like you can, try it, he said. So that's where I was. I went back to Spain and I thought, well, I've nothing to lose, so here we go. And within 6 weeks, I had stopped taking everything the doctor had prescribed for me in Spain. And I was only taking Ayurvedic. And I think by 2 to 3 months, I was beginning to feel not fully like I used to do, but certainly a great improvement. And this is now almost 4 years ago. And I am now back to I'm on low dose of everything at the moment now. And I'm more or less back to being perfectly normal. You've got nothing to lose, and at least you don't get the horrible side effects that you can get with so many traditionally prescribed drugs. Sometimes the drugs will do the job, but it's the after effects and the side effects that you get, which you don't know what's in those drugs. I really always have liked to know what's going in my body. I don't want to take something that I think is going to harm me in any way. And I'm not satisfied that a doctor will prescribe me a box of tablets and say, take this away and take it. Before I take anything that traditional doctors have given me, I read everything to do with the side effects and then I decide if I don't want to take it, I don't. So I had nothing to lose and everything to gain. So I wasn't sceptical about it at all. I just thought, try it. If I tried it and it didn't work, well, I've tried it. But I tried it and it did work and it's changed my life. So I would say to anybody, sometimes people have the fear of the unknown. They think it's a bit hocus pocus, don't know anything about it, and is it magic or how does it work? But every drug that the drug companies manufacture is based somewhere on an actual plant or a tree that has grown, and they make the synthetic version of it. Somewhere in nature, I have always believed, for everything that you can get that makes you ill, naturally in life, that plant or something grows that will make you better. It's just a matter of putting the two together and knowing where it goes. And Dr. Ashok assured me that everything that he deals with is of the finest ingredients and it's pure. If it wasn't, I would have been very reluctant to take it on, because you don't put something into your body that you know is going to harm it. For me, the quality of life is everything. If I haven't got the good quality of life, I don't see the point in living to be very, very old.